Hello, welcome to Chatting with Chitness. I'm Dr. Salil Chitness. I'm a pediatric emergency medicine physician, and we're going to be talking about pediatric medical education. We got a very exciting video, so let's get chatting. And today we're going to talk about croup. So what is croup? So for most of us, croup is just a common cold, but when your kids are little, croup, which is caused by a virus called parainfluenza. It's not related to the flu. It just has the influenza name as part of the name. But basically what croup does and why it's so dangerous is it can cause a lot of swelling in the throat. And when it causes that swelling, your kid ends up having this really funny sounding cough. We call it a croupy cough or a barky cough. It sounds like a seal or like a high-pitched dog, like a chihuahua. We'll put a clip of it so you know how it sounds. The reason why croup gets dangerous is as that swelling in the throat gets more and more narrow, it can close off their throat and then they can stop breathing. So the sign that they're almost closed is called stridor. And what that is, it's a whistle sound that you'll hear when your child breathes in. The best way to hear it is if you put your ear right to their neck. We'll put a clip of how that sounds somewhere around here so you can hear it and be aware of it. Now, if your kid is laughing, crying, playing, and you hear the stridor, it's totally fine. But if they're calm or they're sleeping and you hear that whistle sound when they breathe in, then you need to go to the emergency department right away. Now, what is the treatment for croup? So, actually, surprisingly, one of the best things is cold air. And when I mean cold air, I'm talking about like 30 degrees or less Fahrenheit, cold air. For some reason, that cold air helps with that swelling and helps them breathe better. So if you live in a place where you have cold air and you're worried that your kid has croup, go outside. Put on a jacket and go outside with them, and you'll see that their breathing will be much better. Now, if you live in a place that doesn't have cold air, then the second best thing is hot steam. So I always say, go in the bathroom, turn the shower on full blast heat, get it really steamy, and just sit in the bathroom with your kid, and that will help the breathing. Now, the mainstay of treatment for croup, regardless if they have stridor or not, is steroids. And you're going to get one steroid called dexamethasone. It's one-time dose. And what that steroid does is it makes the swelling go away, it makes their cough better, and more importantly, it doesn't cause that airway to close and for them to stop breathing. Now, if your child does have that stridor at rest, what's going to happen is they're going to need a breathing treatment of adrenaline. So we call it racemic epi, and basically that will open up their airway and prevent that airway from closing. So if your kid does have stridor at rest, you need to go to the emergency department. And that's all we got for croup, so please leave comments so we can chat about it next time on Chatting with Chitness.